I think we might have everyone in the room at this point.
Okay, all right. Well, welcome everyone to the DBSA's Leadership Summit. We're glad you are here, and we're glad you have chosen to view the advocacy survey and results that's provided by the advocacy team. Your involvement in advocacy is extremely important, and understanding what you're searching for and how we can better improve our advocacy efforts is really important. So I'm going to first introduce our advocacy team, which is over here. We have at the top, Eric Scharf, Andrew Smith, Lisa Gaduco, Douglas Haltz, Robert Dabney Jr., and myself, Phyllis Foxworth. So we will be with you all week for those of you who are joining the advocacy sessions, and we look forward to presenting you some great information about our advocacy efforts. However, first, before we do that, we want to also thank you for participating in our advocacy survey. This really helps us to make sure that we're bringing you the programs that are important to you, and that we're giving you the training materials that are important to you to do your advocacy work. So I'm going to introduce Andrew and Eric, who have been instrumental in developing that survey and distributing it, and are going to talk about our results. So welcome, Andrew and Eric.
Thank you, Phyllis. Appreciate that. First, I want to welcome you all to the Leadership Summit. We're really glad you're here. We're excited to have you in this session today. During the session, you're welcome to put any questions into the chat box, and then we will read them at the end and have a chance to have some conversation. Also, at the conclusion of the session and during any downtime during the between leadership sessions, you are invited to visit the Leadership Summit Lounge, which you may have noticed on the interface, the platform, where you can relax by taking part in meditative exercises to learn more about DBSA resources, including our wellness toolbox, the support groups, parents and caregivers, communities, advocacy work, peer specialist programs, etc. So we look forward to being part of that. Our agenda today is simple. We're going to introduce some key advocacy issues. We're going to talk about how we are using those opportunities on our organization's strategic goals. We're going to give you some preliminary data from the survey, and then ask for some input to come to the DBSA team. So with that, I'm going to turn it over to Andrew. He's going to explain our Slido program.
Thank you, Eric. Yeah, we want to make this as interactive as possible. We have a lot of people who are in the room. Thank you all for joining us. But we're going to have a few questions throughout the presentation that we're going to ask you to respond to, and we'll be able to see how everyone has responded in real time up on the screen. And so if you know how to use a QR code, you can go ahead and scan the one that's on your screen right now. Otherwise, if you're more comfortable working on your computer and on your computer's keyboard, you can go to slido.com, that's SLIDO.com. And then you're going to want to enter into the big blue box that you're going to see on this screen here behind the hashtag advocacy track, all one word. And it doesn't matter what's capitalized and what's not. And whether you go to slido.com on your computer, or if you go to, or if you scanned that QR code that we had, and that will be available on all the slides that come up with questions as well. You can scan it at that point in the future if you've missed the opportunity to scan the one that was on the screen. The very next thing that you will see on your screen is a listing of all of our sessions for the week. And that QR code will remain the same for the whole week. So will the hashtag advocacy track. We'll be using that throughout the week. But in order to join this particular session and see the questions and respond to them, you're going to want to click on the one that's at the top of the list. This is our first session of the advocacy track. So Monday today, it's 2 p.m. here in Chicago, where we're hosting from. And that is color coded red on this list. And again, my name is Andrew and I'm presenting with Eric. And so once you select that, then the next thing you should see when I advance to our next question is you should be able to see the question, what inspired you to get involved with DBSA advocacy? And I'm going to give everybody a moment, give you an opportunity to respond. Again, the QR code is on the screen here. If you would like to scan that and didn't have the opportunity to do so earlier. So we've got one response so far, impact. There we go. Getting out the peer perspective, wanting to make a larger impact. So another impact, and finding support, giving support, purpose. So you can see that there's a lot of different reasons that people are choosing to engage with DBSA advocacy. And with that, I'm going to hand it back to Eric.
Thank you. We are really excited to share with you some of the key advocacy issues that we're working on. We are focused on expanding peer support, broadening the adoption of peer support specialists, and amplifying the peer voice. Under the access to peer services, you'll see we work on such things as funding peer services, workforce development, access to programs for veterans. And then under access to quality mental health care, we work on mental health parity issues, network adequacy, telehealth issues, and such. And then improving the mental health care system. Our policy issues include 988 implementation, mental health equity, response to the pandemic. And we have a lot of other types of issues we're working on as well, on state issues around health insurance access, things like various types of kinds of access to insurance programs, and then things like our wellness efforts. So thank you. Next. Earlier this year, the DBSA conducted a communication survey. It was a very high-level survey. They looked at, let's see, 33 questions on demographics of the organization, the relationship to mental health and DBSA, communications methods. They had 1,841 responses to that. A number of those issues looked at advocacy, and we really decided we wanted to drill down a little deeper on that. And so we looked at doing a second survey that went just to our 8,000 organizations around the country, and that are on our list. And so far, we've had 107 responses. We'd like to get a lot more, and so that's one of the reasons today we're doing this, is so that you can get a taste of some of the survey results, and share some of your thoughts too, and have a chance to better understand this, and then to get the word out about this survey. You'll see that most of the people who have responded so far are peers and people who have a direct interest in this issue. Number of different reasons people have participated, and we look forward to continuing that perspective.
So the main purpose of what we're going to talk about today is we're going to present to you some of the preliminary results that we found. But as you can see, we've only had 107 responses so far. The survey has only been open for about a month, and we're hoping to find out from you, what are your main priorities? What are you looking to find from DBSA advocacy? And ultimately, we want to push this group to each and every one of you to go take our survey online if you have not yet done so, so that we can then use that data to understand a little bit more of what our what you would like our priorities to be. And so you can see here that We have a majority of people who are on this call have used the Making Mental Health Matter newsletter. Some of you have also responded to action alerts. Some of you have participated in DBSA peer councils. And so with that, we also want to know regarding DBSA's policy issues, what are some major concerns for you? And one of those things, because one of our key advocacy issues is increasing access to quality mental health care, what are some of the challenges that you've had in seeking mental health services? So we have insurance not covering, finding a provider who's in network. When you do find a provider, people end up on wait lists in order to get an appointment, the cost of care, Medicare issues, finding a provider who takes Medicare, transportation. So we really have a broad spectrum of challenges that people face when it comes to finding access to care. And so then each one of those challenges presents its own separate policy issue in order to address that challenge.
So here we want to ask you to rank the types of topics that show up in the Mental Health Matters newsletter. What are the types of topics you're really most interested in listening to? So please rank. I think we can do up to 3 in this one. So your top 3. In a moment,
Yes.
Andrew will reveal the answers.
Yes. So, so we talked about policy issues. These are our specific issues that we address in the Making Mental Health Matter, and we're curious to know which are have had the most impact for you. And if you don't currently receive the Making Mental Health Matter, you can also respond to which ones would have the most impact.
Mm-hmm. Interesting set of answers. Really helpful to see that.
And interesting that self-advocacy is leading the charge, because I believe on the next slide we have the responses that from the 107 respondents that took the survey so far, self-advocacy was actually not leading the charge there. And so there we had more of an emphasis on access to quality mental health care, followed by medical products and peer support. And so we definitely encourage everyone here to go take the survey, and we'll be providing the link directly to the survey as we go on.
So now we'd like to know which policy issues are most important to you as we move forward. Can you click off again, the top 3 issues that are most concerned to you on the survey?
And I'll give you a moment to rank those, and then we will see how they fare. I guess I clicked a little early. We do have several responses here, so we'll give you a moment to read through the list. So we can see things changing steadily as people vote, but we do have addressing stigma edging out the pack. Followed by improvements in access to care in communities of color and other underserved communities. and then access to care, medical products, and medication, which we have combined for the purposes of not having this list be too long and overwhelming. And on the next slide, I believe when it came to the responses on the survey that the addressing stigma was at the top of the list, but then followed by access to care. So we're interested, the goal obviously of today's session and of our entire week is to inform you, our advocates, about what DBSA is doing and opportunities for you to engage in advocacy, and then encourage you to participate with us, find if there's other resources that you want from us, other things that that we can be doing in order to foster your participation in advocacy with us. But as you can see, the majority of the people who are in the room haven't engaged in any of the ways that are on this list, around responding to action alerts or writing letters to your elected officials. We do have a few people that have participated with that, and even a couple who have scheduled meetings and actually sat down and talked to their elected official. That could have been in person, that could have been virtually. We don't know whether that was prior to the pandemic or in the time since then. But we want to see what it is that we can provide in terms of resources to make that more accessible to you as our advocates.
Okay. Could you please now rank how you prefer to receive your DBSA advocacy information? And this will help us to better prioritize some of the content that we're working on and some of the ways we provide that content.
And I'll give you all a moment to answer.
Okay, that's very helpful to see. Particularly, the interest in the mental health, making mental health matters, never quite rolls off my tongue. And then, but podcasts and action alerts are certainly of very high interest. And that'll help to inform when we move forward.
Yes, and interestingly, it's a little different spread than what well, now it's starting to resemble the spread that we had on of the 107 survey respondents so far. So making mental health matter did rank at the top, followed by the action alerts. Then videos that could include webinars. We are recording this so that we will have this available for future trainings as well. We will be recording throughout the week all of the advocacy track sessions. And then social media posts was down towards the bottom of what people were interested, how people were interested in receiving DBSA advocacy information. Although you can see that there was a pretty close spread from what people wanted most to what was ranked the lowest there. So which of the following strategies do you think would be most helpful to you and the DBSA advocacy program regarding actual strategies to engage in advocacy, actual resources that we can make available to you? And I'll give everybody a moment to take a look at that list. And again, we do have a few things on the list. I'll give everyone a little more time to take a look. So an interesting trend is as the first few people were voting, we saw sample emails and letters rise to the top, which is a lot of what DBSA historically has been doing in our advocacy. But we can see now that people seem to be interested in educational material on how to be a more effective peer advocate at the local level. And so that's some of what we will be focusing on throughout the week, throughout the advocacy track. But this is very valuable information for us to know that that's more of what you, our advocates, are looking for. And so here's a little bit of the spread from the survey responses online. And again, people were looking for that educational material on how to be a better advocate at the local level. We do still have the sample emails ranking and letters ranking right up there. And then followed by self-advocacy tips, which again, that one actually matches how this group responded to our first question, even though that didn't match the trend of how the online respondents did. So at this point, we actually want to encourage everyone to go and take our survey and to let us know what you want out of DBSA advocacy so that we can respond to that, so that we can provide you with the resources that you are looking for in order to engage with DBSA advocacy. And so we're going to drop this link into the chat because we know that you're not able to click on the link that's on the shared screen on the Zoom. And we're also going to take some of your questions that I'm sure have been brewing throughout our presentation. So if you could type those questions into the chat, we can have Meg, who is our DBSA advocacy intern and serving as our Zoom jockey, is what we call the person who manages the call and facilitates the Zoom session for us, that she'll be able to read those questions for us and we'll be able to respond.
I'd also be helpful just if people have any further thoughts or comments on some of the things they see. It doesn't have to necessarily be a question, it could be a comment.
We have a question from Eli. He said, could you describe DBSA's advocacy's general purpose, where you sit in the DBSA organization, and how you work with volunteers?
Sure. I think I understand. I mean, in terms of how we work with volunteers, we often reach out, for instance, when we have a specific advocacy request, for instance, recently we had to have a meeting with a member of Congress's staff in Pennsylvania, in Philadelphia area. So we reached out to the chapter leaders in Philadelphia and asked them to participate in this meeting with the staff member. We're actually doing that shortly in Michigan also. We'll be meeting with Senator Sabino's staff. We're reaching out to folks there. So that's one thing, asking that chapter leaders or other people that we know in those states that can do that. In terms of the broader types of issues, we work on things that help open up access to mental health services and then also the peer support specialist profession. And so it's really focusing on those kinds of topics that we focus. My role as the federal advocacy advisor is to really track what's happening here in Washington, D.C. and stay on top of those kinds of topics, federal legislation, federal regulation. Andrew is more focused on what's happening at the state level.
And I should also add the caveat to our key advocacy issues around increasing access to care, increasing access to medical products, and promoting the value of peer support is that DBSA does not endorse treatment. We don't endorse any particular type of treatment. But what we do, however, is for those peers who believe that they need access to treatment, whether that be medical products, whether that be talk therapy, whatever it is, that's where we fight for access. So that, and that includes our issues around drug utilization review, meaning is your insurance willing to pay for a medication if you and your doctor engage in shared decision-making and you and your doctor decide that that's a course of action, there's a particular medication that you believe would be the best fit for you, that no one else should be able to stand in and say, well, no, you can't have that medication, you have to try something else. The same goes for actually seeing any particular doctor, whether it's a psychiatrist, or even if that's a therapist, counselor, anything like that, that there should be no one that is preventing you from being able to seek care if that's what you seek. But again, we're not endorsing treatment. We're not endorsing any particular type of care, but we are fighting for access. And so Eric mentioned his specific role is as the federal policy advisor. I am the community engagement program manager. As such, I am responsible for our state level advocacy. And as one person, I can't be in all 50 states at once. That is where we really rely on our advocates, that is all of you, who can keep yourself informed about what's happening in your state, what's happening at the local level, as it relates to DBSA's key advocacy issues, and then keep us informed so that we can respond, so that we can inform our advocates, other advocates in the state. Sometimes DBSA responds directly, writing just a letter, a comment, a letter of support, or a letter of opposition directly from the organization, depending on the circumstances and what is called for. But another thing that I do as the community engagement program manager is I'm always looking for ways to move advocates up the chain, to go from just responding to the action alert that we send out and sending the sample email or the sample letter to your representative, to then being that person who informs me of what's going on in your state, and to also helping you develop your story. If you decide you want to sit down with your representative or any other policy maker, virtually or in person, to give you the opportunity to hone your story so that you can use your personal lived experience, put a face to a policy. Hi, my name is Andrew, and this is how this policy is going to affect me as somebody who lives with depression. Because if I sit down and tell you my life story, just from start to finish, you're going to walk away wondering, okay, what did he want from me? But we will work with you if this is what you're interested in to learn how to weave your personal experiences into the policy issues so that we can then put a face to a particular policy. And that's so much more powerful when we're talking to those policymakers. And I see that we have some more questions.
All right, next question. How do you all gauge success of the DBSA advocacy efforts, both internally and externally?
That's a good question. One of my first bosses in DC, when I asked him one day if we'd won the war in this particular issue, he said, in DC, you never win the war, you win lots of small battles. And that's one thing I've learned. This is a very incremental process. So it's always very hard to know when we're making progress. But for instance, several years ago, back in 2008, there was the mental health parity law that was passed. It was a significant achievement in achieving mental health parity. But since then, we've had yet another series of enhancements to that. Right now, we're working on trying to get the Medicare program to see parity around physical health versus mental health. And so it's a continuing process, and it never really ends. There's always more things we need to work on. Right now, we're working on the 988 implementation. That was a big achievement last year, but now there's 2 years of stuff happening both at the grassroots level and at the national level to build out the 988 response system, including crisis response systems in your community. And that's an important opportunity for you at the local level to work on. So there's a variety of different ways we can do that.
And my answer to that is always very, very different, which is we do want to move the needle. We do want to change these policies that are going to affect people living with mood disorders. But that's really the icing on the cake. The reason why I'm even here, the reason why this entire department is here, is to give you as our advocates the opportunity to engage in advocacy. And the reason why we do that is because we believe that participating in this process can be a tool in your own wellness toolbox, that speaking out for yourself, speaking out for your community is empowering, and that can also be something that contributes to your wellness. And so that's how I measure our success. Obviously, if we didn't move the needle at all and every policy we worked on didn't go anywhere, I wouldn't be heralding that as a massive success. But that is my primary measure: is are we giving you the opportunity to speak out for yourself? And that's more than just self-advocacy. That is also participating in the process with us to make your voice heard in order to let the larger community know that we have something important to say.
Thank you. I would echo what Andrew is saying there about the importance of self-empowerment. For myself, I come to this work as a person who lives with major depression. I work very part-time for DBSA, but I do it and put in the extra hours, so to speak, because it's been instrumental to my recovery from mental health in terms of being able to use talents and skills that I had for many years as an advocate here in Washington, D.C. So it is an important piece there. I did get a sub-question was to what is 988? You are probably familiar when you call 911 when you have an emergency. When the house is on fire or there's been a police emergency. We're trying to now get people to call a new number, a new 3-digit designated number called 988. This is going to be in July of next year. There's, like I say, a 2-year process to implement this. And many communities are also working on what's known as 911 diversion, so that when someone calls 911 and the 911 operator determines that it's not really a police emergency, but it's a mental health emergency, they are then sending those calls over to trained people, many of whom are peer support specialists, but trained people who can then respond to that call either on the telephone or in person with trained mental health specialists, as opposed to police specialists, when it's determined that is not a life-threatening situation. So that's the bigger picture of what 988 is. It is both a telephone response system, but it's also a community mental health response system that we're building out. Really, as one of the people at the federal government, this is a once-in-a-life opportunity to improve local community-based crisis response systems, and we're very excited about being part of that. Our next question, Meg?
Someone asked, how can I get involved in group meetings with legislators?
That's a really good question. I think there's a couple of ways to look at it. One, for instance, here on the local level, I live in Washington, D.C., where there's also a community-based response system. I just, on behalf of the local chapter, the DBSA chapter, started reaching out to various legislative policymakers. I'm involved with our local mental health clubhouse to meet with them about various concerns. That led to my being invited to be on the DC Medical Care Advisory Committee, which is oversight for the DC Medicaid system. It led to me being involved with the DC 988 implementation task force. So it's, again, it took 3 or 4 years for me to get known to these people, for them to know me, and to be invited to the table. And so I would say partly it's just showing up. It's going to meetings. When you hear that your local county board of mental health is having a meeting, go to the meeting, introduce yourself to some folks, tell them that you're part of DBSA, let them know that DBSA locally has some policy concerns, wherever they might be. Perhaps it's, again, access to the Medicaid system. Perhaps it's providing homeless services and ensuring that homeless services have mental health access to services, wherever it might be. But basically, it's just showing up is, I think, the first starting point. In terms of your state legislatures, work with, say, your NAMI chapter, or work with Mental Health America's local chapter. They have a very good, robust public policy program, and they are looking for additional voices from the peer community. So I think that's another good starting point. Andrew, do you have any thoughts on that?
Yeah, so Eric mentioned NAMI and MHA, and this is an excellent place for me to make a plug for the National Council for Mental Well-Being. They actually just changed their name this past year from the National Council for Behavioral Health, if that name sounds familiar to any of you. That every year they have Hill Day in Washington, D.C. It's a major fly-in where they partner with a lot of different organizations, including DBSA, and we help them promote and help to drive attendance. And it's an excellent opportunity to learn more about how to host a legislative meeting, and then to actually break into groups of other advocates from your state and go to the Hill and have those meetings. Last year and this year, that event has been virtual because of the pandemic. And that event is coming up on Tuesday, October 19th. Let me make sure I've got that date absolutely correct. Yes, and the training for that session, for that event, is going to be on the 19th from 1 o'clock to 4 o'clock Eastern time. And then throughout the week and the month, the National Council and DBSA will be encouraging people to schedule virtual meetings, because again, because of the pandemic. And so we can work with you on how to contact your legislator, request a meeting, how to actually conduct that meeting once you get that staffer or representative or other policymaker in the room with you. Because again, going back to how do you use your story? If I just tell you my story and you don't know what it is that I want from you, then that's not an effective meeting. But if we can work together on targeting your story to drive the message of what you want that policymaker to do. We also have other opportunities that we put out calls to action to our advocates, asking if anyone would be willing to meet with a legislator. But my door is always open. If you would like to schedule your own meeting and would like some help and guidance in that process, I encourage you to contact me. I will be putting my email address in the chat. And please feel free to use that to reach out to me directly.
Yeah, I will do the same. Certainly, if you have any interest in what's happening in Washington in terms of federal legislation, feel free to reach out to me as well. I'm happy to provide you with updates. We actually have a summary of this information. We'll be presenting on it later this week in terms of what our public policy agenda is. Meg, another question with a few minutes remaining here.
Yeah, so related to that, does the DBSA advocacy team collaborate with organizations like NAMI? Do you all have advocacy efforts targeted at organizations like NIMH versus lawmakers? And then they had a follow-up question. Does your team need/have capacity for volunteers?
Yes, I'll say on the national level, we're active in a group called the Mental Health Liaison Group, which is over 80 national mental health organizations, ranging from American Psychiatric, American Psychological, to the National Council, to NAMI, to MHA, to a number of other groups involved with the range of mental health issues. And within that group, we have recently helped start something called the Peer Support Work Group. So this is about 8 or 9 organizations that have specific interest in peer support issues. And we've been meeting every 2 weeks and talk about specific legislation. For instance, there's the Medicare Peer Support Bill, there's the VA Peer Bill that we're working on, a number of other pieces of legislation. So we do work very closely with our allies in the mental health space. In terms of volunteers, yes, again, reach out to either Andrew or I and identify what your interest is, and we can definitely find ways for you to advocate, whether it's on the local level or again on the federal level. Andrew, do you have anything to add to that?
The only other thing that I was going to add to that regarding training is that this whole week is going to be all about training. And so we invite you to come back to learn more about DBSA, our advocacy, what we're doing, and how you can participate with us. And then we are also recording this, making this available. And we're going to find various platforms that we can pull from this training in order to be able to reach people who haven't been here, who weren't able to get into the room today to participate with us. Another question that I saw was asking to repeat the training for Hill Day. So the actual training is taking place on Tuesday the 19th from 1 to 4 p.m. Eastern time. And then the meetings will be taking place after that. And again, there will be some meetings that will be scheduled and we'll be able to inform you about those, but we can also support you if you decide you want to schedule a meeting and help you through that process.
And then we had one final question for people new to advocacy. Can you explain what action alerts are and how to sign up for them?
Absolutely. So an action alert is is basically clicktivism. You know, we send you a communication, we ask you, click here to contact your representative or whoever the case may be. And then when you do, you're taken to a pre-written email. I write that email. You can change it, you can edit it, add your own story. But then when you do click here, it sends a communication from your email address to your policymaker, whoever that might be. And it's an excellent way for people to dip their toe in the water of advocacy, try it on for size, see whether they like it. Again, we're always looking for people to participate in a more interactive way with that, but that's a good start for it. And you can receive those action alerts by going to dbsalliance.org/take-action, and I'm putting that in the chat right now. And that is also where you will receive the Making Mental Health Matter newsletter. And so that's a good way to stay informed. One thing that the newsletter does for us is gives us the opportunity to educate you, our advocates, about what the policy issues are. That way, when we do send out the action alert, we can say, you know, that thing we've been telling you about, now's the time to contact your legislator. Now's the time to let them know that this is important, instead of me having to educate on, here's an issue, this is why it should be important to you, and now we want you to go do something about it. And so I encourage you to engage with the Making Mental Health Matter newsletter as well. And I see Eric placed the sign up for Hill Day in the chat as well. Thank you for doing that, Eric.
Well, we're right at time, it looks like. Meg, was there any one last thing that you wanted us to comment on? Are we all set or not?
Nope, we're all set.
Okay, great.
And
well, I want to thank you all for coming and attending today.